so much for joining us today for this incredible panel. I hope that many of you had an opportunity to watch the film BEDLAM, but if you didn't, no worries. I think this discussion will be very interesting to you as well. My name is Deanna Rhodes, and I am the Executive Director of Connect Summit County, and we are co-billing this conversation today with the YWCA of Utah. And you know, Connect Summit County, our mission is to create a well-informed and stigma-free community with access to mental health resources for everyone. And so today's conversation just seems incredibly timely with some of the unrest that is going on in our country and some of the calls for defunding the police. I think this conversation actually kind of addresses what does that even mean and what we possibly could be doing. And so I'm really excited about the panel we pulled together for this conversation. You know, one of the things that we thought was so relevant to us, specifically in Summit and Wasatch County and the state of Utah, is recently HB 32, sponsored by Republican Utah State Senator Thatcher and Utah Republican State Representative Elison. They were able to pass this bill for mobile crisis outreach team. And that is expected to actually come online this fall. And we're really excited because this is such a great way forward. And so we wanted to pull together this panel and just have a discussion. We have 1 hour, so we're not gonna get to the end of it. So if you have questions, please put them into the chat so that we can try to address them after the panel is over. But we're really excited about starting this. So thank you so much. And I'd like to, with that, throw it over to our moderator today, and I will introduce him. So former Utah State Senator Steve Urquhart is our panel moderator today. And I want to just insert in there a couple, I think it was about 2 months ago, I had noticed he had driven a conversation about this topic online on his Facebook page. And so I thought he would be a great moderator for this conversation because I could tell that he was really curious about the conversation. So excited for that. He was a Utah State Senator representing the state's 29th Senate District in Washington County. Prior to that, he served in the Utah House of Representatives. Steve is a founder of the Partnering Institute of Africa and director for Red Butte Garden, Equality Utah, and Salt Lake Area Restaurant Association. For successfully championing difficult causes, Steve was honored by the ACLU, Equality Utah, and the Utah Pride Festival. We are proud to have him moderating this panel discussion today. So thank you so much.
Thank you. What an honor to be here. I'm excited to be affiliated with Connect on this and very excited about all of our panelists who have great things to say, so I'm not going to take up their time. Let's go ahead and start with some introductions. So I will announce who you are, and then please tell folks what it is that you do and your interest in mental health. Let's start with Aaliyah Hall.
Hi, my name is Aaliyah Hall. So I am a licensed clinical social worker. I graduated from the U's program and have been in practice both private and within the community for the last 15 years. I deal mostly with trauma, both racial and gender-based trauma. And so I have a lot of clients that are encountered in this circle.
Perfect, thank you so much for being here. Next, we have Detective Felicia Sotelo. And I'll tell all of you, we agreed to dispense with titles. We're just doing first names. And so Felicia.
Hello, I am Felicia Sotelo. I'm a detective in the Summit County Sheriff's Office. I am currently assigned to the Summit County Sheriff's Office Drug Court and Probation Program. It's a very fulfilling position to be in. My personal interest in mental health stems a lot from my own family member that suffers with mental health, and it's very important to me, not only professionally but personally.
Terrific, thank you. Dr. Anu Asnani. Again, dispensing with titles. Anu.
Yes. Anu, thank you so much, Steve. So I am a licensed clinical psychologist in the state of Utah, and I'm also an assistant professor in the Department of Psychology at the University of Utah. And I was in practice for the past decade prior to moving here to Salt Lake City in the past year. up and down the East Coast, Boston, Rhode Island, and Philadelphia, where I was for about 10 years. And so my interest certainly is from a professional point of view, but I was actually struck, particularly relevant to this documentary, I was struck by institutionalization of individuals with severe mental illness. As a child, I grew up in the Caribbean, and the mental health scene there is very, very different. And it's something that stuck with me as young as 4 or 5 years old when I saw that our mental hospital looked like a jail. And it was something that I posed, I remember, as a 5-year-old to my family about why people who were ill were being kept in jail cells. And so it was really interesting to see that that's still the state in a lot of our global mental health settings. And it's certainly still the state here, and it's gone back and forth. So I'm excited to have this conversation and hear from everyone about how we think about mental health and how we take an empathic, therapeutic, and empowering stance towards our fellow society members who are struggling with those issues.
Great, thank you for being with us. Julia Lachlan.
Hi, so I'm Julia Lachlan. I'm educator for families, a family educator for the National Alliance on Mental Illness. I've been doing that for 7 years. And I also have 2 family members who struggle with severe mental illness. So glad to be here.
Thank you. Liz Owens.
Hi, I'm Liz Owens, and I am the CEO of YWCA Utah. This topic is important to me both personally and professionally because it impacts our communities, the health and safety of ourselves, our loved ones. And I really believe that a true measure of society can be found in the way in which we treat our most vulnerable. So I'm also really excited to participate in this conversation.
Thank you. Thank you. We're excited to have you. You've hit the ground running in your new position, and we thank you for that too. Okay, let's start talking about lived experience. Julia, you said that you have family with some mental health issues. I watched BEDLAM, and it really hit me hard because this was new to me, seeing that facility, that situation. It wasn't new to you. Please talk about that.
Yeah, today is actually our son's 24th birthday, and he spent years in the mental health system, sort of cycling, as we see in the film, through homelessness, jail, hospitalization. He eventually made his way out to California and continued cycling through those 3 things, just like we see in the film. And a big part of what the message I wanted to share here was that this is a universal problem across the country, that you can't just look at LA and go, wow, what a mess. These issues are everywhere. They're certainly here in Utah. And a big part of what I want to support being on this panel is just for family members, the toll it takes on them as well, and to help family members get access to the resources they need so they can be there to support their mentally ill loved ones.
Thank you. Thank you. And part of what we saw in the film was engagement with the police, and that might be part of your experience, your son's experience. So that's our next topic. So we'll come back to you on that. Liz, can you talk about the YWCA and what's going on there with trauma and mental health issues?
Yeah, sure. So from the YWCA's perspective, we have women and children who are dealing with current mental health crises and who are navigating current and also past trauma, and that's expressed in numerous ways. As an organization, we also recognize that supporting and collaborating with people who are in the midst of traumatic crisis has an impact on our direct care staff and actually on all of our staff and our organizational systems in general. And so we're keenly aware of both the longer term and ongoing mental health considerations of our participants, whether it's a mental health diagnosis or ongoing mental illness, and concerns related to experiences of violence, homelessness, or other traumas that are experienced by the most and very vulnerable and at-risk populations that we serve. So additionally, maintaining a trauma-informed organizational model serves our domestic violence programs, but it also serves our broader programs and the broader community in multiple ways, because we really try to introduce and embed approaches to considering and attending to the mental and emotional well-being of our staff and our participants, from young women's leadership to our child care services to our political advocacy, that really recognize the mental and emotional well-being of all of our community members, which Julia spoke to as well, that this impacts us all. And wherever we are, in not only in the country, but wherever we're sort of located in terms of vulnerability or a current mental health crisis, it's sort of, there are times in our lives where we may experience increased crisis and need increased services and access to mental health services. And so at the YWCA, we've become certified in a model called Sanctuary, and it's a trauma-informed organizational model, and it really provides tools and resources for us for attending to trauma. And what I hope is that it cultivates an environment and a culture that names mental health considerations and impacts that we see in ourselves, in our staff, in our participants, and really recognizes the way in which we impact each other and our crises impact each other and our organization. And so in attending to and naming those considerations, we're able to, or what our work is really asking ourselves, how do we address with knowing about trauma, knowing about mental health considerations from our participants to our staff, me, everyone here, how do we attend to that? How do we address it in all of the things that we do in a way that is compassionate and supportive?
Perfect, thank you. Yeah, the point of why we're spending this hour together is to raise awareness and to forward a conversation on mental health, but then also to talk about creating what does effective response, crisis response look like that can help with recovery and stability. And so, yeah, I want to come back to you and talk about what happens on your campus when there is an issue. At what point do you get the police involved, and what does that look like in a way that is good for the individuals? So we'll come back and discuss that. Aaliyah, do you have a client experience that you might want to share with us? Now you're muted. Aaliyah, you are muted. I wonder if I can unmute you.
Can you hear me now?
There we go. Hi.
All right. Okay. So in the 15 years that I have been practicing here in Salt Lake County, particularly as a licensed clinical social worker, I have, just as Liz was talking about, I've worked with both the breadth and the depth of our community, both through government work as well as private and public practice. I've worked in the juvenile justice system as well as in the hospital system. And so I've seen how mental health works in our school system, how mental health works in our hospitals, how mental health works through our juvenile justice system as well as our adult justice system. And within the breadth of our community, there is not a family, a community, a socioeconomic status, race, a gender, a level of education, nor finances that isn't touched by mental health in our community. This is, has been and continues to be, and I love the work that NAMI does, because oftentimes that as it talks about in BEDLAM, that these are family secrets oftentimes, and that secrecy in the family is what keeps people from accessing the help and the tools and the support they need. And so myself as a mental health provider really seek to support my clients wherever they are encountering mental health facilities and policing, to reach out and to get the resources they need. I often recommend people for drug court and mental health court as well, because I think that it is such a powerful program when used appropriately.
Okay, thank you. Anu, anything to add to this part of the discussion?
Yeah, no, just in terms of that lived experience, just to echo what others have said, I was really struck in the film. One of the main characters, Monty, talks about, you know, people look at me and they see a big black man, and they don't see somebody struggling with something. And I was really struck with part of, you know, part of the issue around this lived experience is the secrets that Elia just mentioned. It's the stigma, it's the self-stigma, and it's a lack of education, right? And so part of even the focus of some panel like this is to try to bring, and that's this documentary for sure, is to bring education about what is mental illness and how should it be policed versus should we be taking this therapeutic role towards it. And what Monty said really like struck me very similar. I used to do a lot of work before coming to Utah in the VA's system in addictions, right? And I worked with a lot of veterans of color who had this, you know, I am struggling with this addiction and yet I'm Black or I'm a person of color. And so when I'm looked at as a criminal instead of somebody who's struggling with a mental health disorder of addiction, and feeling that same tension of what they're seeing in me is overriding what my lived experience is, where I'm struggling and I need help. I don't need jail time to help me with this addiction. I need to be in the VA, or I need to be with a therapist, or I need to be in a system that actually supports that instead of polices it. So it just kind of, there were a lot of parallels, even though there's singular cases in this documentary and even maybe in what we share here that are just consistent to what we see in Utah, what we see in California, what we see on the East Coast, of an endemic issue around the way we even look at mental illness and how things like race or stigma or family stigma can color what we choose to see in individuals who are struggling. So that was just impactful seeing that.
Okay, thank you. Felicia, we see in the movie that law enforcement becomes a catch-all in this area, as it is in so many parts of society. I imagine you could take us to the end of the hour on this question, but what do you see from the law enforcement perspective? What resources do you have? What resources do you need?
Well, Steve, you're absolutely right. We could talk about this for a very, very, very long time. I think in Summit County, we're extraordinarily lucky. We have such a close-knit community, and I feel like everyone is on board. Everybody wants to come together and be problem solvers and have solutions. But law enforcement often is the catch-all. And I think from my perspective, you know, I spent time on patrol before I came to drug court. What happens is things escalate at home, and it probably comes back to that family secret, to that stigma, to that shame. No one wants to talk about it. Situations at home get escalated, and then it's out of control, and there's no one else to call but law enforcement. And so at that point, chances are there's been a crime committed, and, you know, law enforcement, that their job is law enforcement. Their job is to enforce the law. And even if we respond to something and we can see someone's in a mental health crisis, in Summit County, the only place we can take them is the emergency room. And if they won't go willingly, getting them actually committed against their own will is extraordinarily difficult. I mean, law enforcement doesn't even really have that power. So if there's been a crime committed, oftentimes they have to go to jail, because if we take them and drop them off at the emergency room, then whoever contacted law enforcement is now at risk of being retaliated against. And so it's such a complex, multifaceted issue that there's not just one simple thing that's just going to fix this. I mean, it's going to take an entire village across the nation coming together to make this change. But I think in Summit County, we're ahead of the game. I like to think anyways.
Good, thank you. So Julia, the topic is engaging with the police. Let's take the last topic, lived experience, and pull that forward into this topic for us, if you will.
You know, our experience has been all over the place. Mostly it's been, we certainly had police come to our home. We've had calls from police letting us know that our son has been hospitalized. We've had all kinds of interactions. From my perspective, I would say that they've all been positive, with the exception of the times that the police have come across our son when he's homeless and off his meds and psychotic, So he is sometimes stealing to get food. You know, he is sometimes doing criminal activities. And them not realizing that the underlying problem here is mental illness and not this petty crime that's going on. And so him getting taken to jail. And in one case in Salt Lake, being released from jail at 2 a.m. when it was 10 below zero, to the street as a homeless person.
Oh my.
So it's just been such a mixed bag. I think that so many sectors of society, you know, the criminal justice system and police are included, so are libraries, so are all kinds of places. So many people are becoming de facto mental health professionals who don't have the training to be that, and they're trying to get the training to help, you know, including families. So it's really a struggle. I will say that the times we've had the police at our home, they were very good with our son. They seemed to understand how to talk to him, and that person with a uniform showing up really got his attention, which was helpful for us because we weren't always, I mean, I'm 60, my husband's 65. We cannot, some of these situations we can't deal with ourselves. And so by and large, the experiences that we've had with law enforcement have been really good. And I think the times they were lacking are just because the resources to support them are so lacking and to support so many areas.
Thank you. Thank you. I'm very excited to come back to you on the next topic. I'm sure you'll have some insight on that. It's where do we go from here and what are the solutions? But okay, continuing on this law enforcement. Liz, can you talk about YWCA's involvement with law enforcement?
Yeah, so it's not common, but it's not uncommon that we do need to contact law enforcement for additional support when managing and navigating someone's who is in a mental health crisis at the moment. And like Felicia and Julia spoke to, as families find themselves unable to maybe support a person when they're in the midst of a crisis, we also find ourselves, and we have ongoing training and conversations. We've done this huge shift to really center our work on the mental and emotional well-being of everyone who engages at the YWCA. And we still need to call for additional support when we feel that the person is at risk, their safety is at risk, or someone on campus is or the campus in general, that there is a risk posed to the safety here, maintaining that safety. And our relationship with the police is to continue to maintain our approach and advocacy for that person so that we can ensure as much as we are able that the process is trauma informed and really asks the question, what happened to you, and not what is wrong with you. That's kind of our advocacy kind of grounding, what's happened to you, not what's wrong with you when anyone is going through anything. And so we do have to call the police, and we have had, unfortunately, in the past year, tragedies on campus with folks who were struggling with mental health considerations. And so it's a real present every day, every minute kind of consideration and concern that we have. And we really have, again, shifted to build a culture that attends to it. And in that way, we hope, again, that it de-escalates, sort of mitigates something from increasing to the point of an incident, but it does happen. And we have been able to work in partnership with local law enforcement. We have a close relationship with them because of our services, and we just really try to continue to advocate for the person who is needing that additional support.
And there might not be a compact answer for this, but as a trauma-informed organization, what are some things that your staff do before the police is called to try to avoid that interaction?
Well, again, I think, so there are some just de-escalation techniques around just sort of your body placement and listening and offering choices. And those are all really important. And also, again, we're really hoping to sort of mitigate any kind of incident from happening by checking in on people regularly, by creating space so that they can share how they're feeling, by connecting them to resources, by making space for them to express themselves, whether that's if they're in distress, whether that's in a room by themselves or being able to be physical with pillows and that sort of thing, or whatever it is, just to be really in touch with the folks, both staff and participants who are impacted by this work. And just the trauma that we all encounter in our daily and personal lives. And so in terms of like de-escalation in the moment, there are techniques that we practice and train on regularly. And again, our focus has really shifted in how do we shift the culture here so that there is normalization about the mental and emotional struggles that we all go through, and so that we are attending to those issues as they start to come up, and not allow them to really boil over to a point where we need to call the police. And when we do need to call the police, how do we maintain that kind of advocacy for the individual in which we're calling the police for support with?
Okay. Thank you. Aaliyah, as a clinician, can you talk about law enforcement interactions, or I think what we're shooting for is avoiding the necessity of bringing in law enforcement?
Absolutely. As a mental health provider, we do everything we can possibly do to not bring law enforcement into the situation, because we do know that law enforcement is taxed. We do recognize that law enforcement has a very specific job and very specific protocols. And so we try to do everything that we can as clinicians to avoid involving law enforcement as much as we possibly can, which is including using NAMI to bring in their families and educate their families, bringing in the Y and other shelters and things like that. So utilizing every resource that we possibly can, including therapy, to keep people out of law enforcement's jurisdiction, or out of having to engage with them in that way. Because what we found is, even with the best intentioned police officers and those who are trained, that seeing a uniform increases a person's anxiety. Just seeing a police officer increases their anxiety, however well-meaning they may be, however well-trained they may be, however, whatever their role is. And so on the occasions which unfortunately are more frequent than I would like, we do have to call the crisis team here in Salt Lake and have them come out, because people are suicidal or they're psychotic when they come into our offices, or when they come in to receive services. And what we try to do is to do all the prep work we possibly can before the police arrive, to help the client know what's going to happen, who's going to come, and what that's going to look like. We try to get their family involved if they can come down to participate in those intakes and interventions, because the more friendly faces, the more faces of people that you know and that they have relationships with, the less likely it will escalate into something that's unfortunate for all of us.
Okay, thank you all. Anyone else with anything on this point? Okay, let's move on to the next one. Looking forward, where do we go from here? What are the solutions? Felicia, would you please talk about Summit, Wasatch Counties, and the Mobile Crisis Outreach Team?
Steve, I'd be really happy to talk about this.
I bet you would.
Getting a mobile crisis outreach team for Summit and Wasatch County is incredible. Absolutely incredible. It's going to be such a benefit for everyone in this county, our citizens, our law enforcement, our therapists, our hospital providers. Everybody is going to see the benefit of this. So the mobile crisis outreach team can respond to someone who's in a mental health crisis, and either stabilize them or get them to an appropriate hospital facility. This is valuable because, like you mentioned, Julia, you know, if your son was shoplifting because he was hungry and and couldn't eat, but was also in a crisis, sometimes, unfortunately, jail is the only safe place for them. But with a mobile crisis outreach team, someone in that situation might be able to go to an actual hospital and be stabilized in a hospital facility where they're comfortable, they're going to get the help they need. But beyond that initial response, I think a big part of this is creating the avenue to treatment beyond the crisis. So many people have crisis and then they get stabilized one way or another, whether it's in jail, hospital, however they get stabilized, but then they're just let out again to their own devices, and there's no one really there to help them along, to remind them, hey, you need to come and do this. A lot of times family members try to be involved in this, but speaking from my own experience, my family member, when they're in crisis, they don't reach out to me. They don't reach out to anyone. I don't even know where they are. So me trying to help them get the help that they need is impossible. And I know I'm not the only person in this situation. So I think that the backside of it is going to be equally important. So I'm really excited about it.
Perfect. Well, I hope it goes very well. We're all excited too. Okay, Julia, talk about the families, will you please? What resources do families have? What do they need?
The need is huge because it's so stressful, obviously emotionally, when you watch the movie and you see the family members and how heartbroken they are and how desperate and searching for some kind of support. So family members really, really, really struggle in these situations. And the National Alliance on Mental Illness is a huge opportunity for them to find support and education. And I know when I first took the class I now teach, which is called Family to Family, which is an education course, that course, it kind of saved me. It helped me learn obviously more about mental illness, but it also helped me see I wasn't alone. The other people in that room with me who shared their stories. And I mean, I looked around that room and I thought, boy, I'll keep my stuff. There were some really rough stories in that room. And that's the piece that NAMI offers to all of us. And these courses and support groups both, they're free. They're all over the country. Of course, right now they're virtual, which if you live in a rural part of the country is a huge boon. Because I know, like my mom, for example, lives in a part of the country where there isn't a NAMI affiliate in her county. So now this is all these free support groups, all these free education classes for family members, they're all online. So that's great. And I just so encourage people to look up the National Alliance on Mental Illness. You can participate, of course, one of the few gifts of COVID is you can participate now in national events online, which I wasn't able to do before. So there's support for our family members struggle with mental illness and for us. And if we can't stay well, we can't support our loved one. So that's such an important piece for us. And I wanted to circle back just really quickly too on what Felicia said about ongoing support as in addition to crisis support. When we saw in the movie that heartbreaking piece at the end where Monty becomes homeless again after everything, all the support, all the just heartbreaking to watch. And there are, right here in Summit County, we have a Clubhouse, which is an international organization that does exactly that. It's a place where people who are struggling with mental illness can show up, be with their peers, construct a work-centered day, get support finding employment, all kinds of support to make that ongoing recovery, help make that possible once they survive that crisis. And we all know, everyone here knows, those crises come up. It isn't like you have one crisis and you're done. And it's good to know that there are things like NAMI, like Clubhouse International, so many other organizations that can help in that prolonged, what happens when you get out of the hospital? Because that's when the really hard stuff starts. How do they stay in recovery?
Okay, thank you very much for that. For people who joined late, let me make introductions as we go along. So Julia Lachlan just talked to us, and Julia is a NAMI educator for families and also has talked about her lived experience with her son who has mental health issues. Aaliyah, who is a licensed clinical social worker, you spoke earlier about stigma. The topic now is, where do we go from here? What are the solutions? Can you talk about stigma in that context?
Absolutely. We don't talk about mental health in our communities. We don't talk about the family secrets. I loved in the documentary, it talked about the Kennedys and what happened to Rosemary, because from top to bottom, there's a huge stigma for mental illness, and conversations like the one we're having today, organizations like the one that Julie is a part of and Liz are a part of, start to break down some of those barriers of just talking about mental illness and what it looks like. Just on a personal, on a personal account, like in my family, there's mental illness. I'm a mental health provider, and it's still really difficult. It's difficult to know what to do. It's difficult to know how to help. It's difficult to get other family members involved, because it really does take the entire family, an entire village, an entire community. And for us to be able to rally the troops and circle the wagons around those of us in our communities and those of us who are struggling with mental illness, we need everybody. We need everybody. And so reducing that stigma, having conversations at every level, having conversations with every organization, educating, talking to families, educating families about how to talk to their children. You know, so many of the clients that I see and I have seen were children with mental health issues that didn't know how to talk to their parents, or did talk to their parents and their parents didn't know what to do. So, you know, there's a lot more resources available to children, but if they don't get them, then they do turn 18, and then they are pushed into the locked-in law enforcement. When they're adolescents, they could have gotten resources that aren't always available to adults. But making those resources available to adults. You know, we spend a lot of money on a lot of different things, but this, like the film, like BEDLAM said, this is a national crisis and has been for decades. And we see it throughout our communities, in the streets, in our prisons, secreted away in our homes, and we don't talk about it. And as long as we continue to not talk about it, as long as there's shame for the family, shame for the individual, we will continue to see a crisis.
Okay, thank you. That was Aaliyah Hall. Dr. Anu Asnani, licensed clinical psychologist and professor at the University of Utah. We've been talking about education. That's right up your alley. Do you have anything to add to that?
Yeah, so I already, so well said by everyone so far, and Julie and Aaliyah just shared lots of solutions and resources. So I'll just add on. I think the education piece for ourselves as individuals, for our families, is huge. NAMI is a great source for that. There are other online repositories to understand individual symptoms that can supplement or be adjuncts to what NAMI provides. Like American Psychological Association Division 12 has all these fact sheets for what caretakers can do and what are different symptoms. And so I'm happy to share some of those links to add to what I'm sure Julie and Aaliyah are going to share from their experiences, and others as well. But I was going to say education at the other level is education of our providers and education of our partners in the law enforcement areas. So some of the work that I've done is in the prison service in Sweden, where we actually went in and worked with wardens to try to help them understand what mental illness looks like. How can we bring some of the great things that Felicia already mentioned and Liz mentioned about kind of de-escalating situations. How do we take a different tactic when it's somebody who has a mental health problem, plus they've broken a law? How can we kind of approach those? So education on the level of those who are providing the resources, our frontline folks, education on the level of a lot of the work I do back in the Caribbean that we're now starting to think about doing here is working with first responders and police officers in trauma units to figure out how do we work with, for instance, rape survivors in a way that's more therapeutic and less re-traumatizing for them, and that sort of thing. So I think education on those multiple levels. I'm thinking about other work that we did was working with adolescent perpetrators of sexual assault, right? We always thought of this idea of we're going to work with adolescent survivors of sexual assault, but the perpetrators are also traumatized. If they're doing that, there's a lot going on. Like I said, it's multifaceted. So I think about education across all the stakeholders. That's how we can partner together to actually move that needle forward to making that difference. A lot of our work has been just educating those who are like preaching to the choir. We are on board with that, right? Already on board with that. We need to kind of make that education wider spread, general public, those who are actually suffering from mental illness, those who are helping them in all the different domains, and family members who are supporting them. So I just wanted to add that.
Okay, perfect. And thank you. Perfect segue to the next topic, which is bringing all the stakeholders on board. So let me go back to Detective Felicia Sotelo with the Summit County Drug Court. Earlier you said that there is a lot of collaboration going on in Summit County. Tell us about that. What does that look like, and how do we get collaboration in all areas? How do we get perfect collaboration among all stakeholders?
Well, I don't know if I can answer the question about perfect collaboration. I don't think anyone's quite figured that out.
Yeah, I might have
yet.
stretched on that.
We're very fortunate in Summit County to have Healthy U, University of Utah Healthy U, as our behavioral health substance abuse provider. It's a fairly new partnership, but they have crisis services that we as law enforcement can actually take someone in crisis to their facility during the week and get them seen. And a lot of times that eliminates the need for going to jail, eliminates the need for any further law enforcement interaction at all. If patrol responds to someone that hasn't broken the law, and that happens quite often, but patrol can tell that this person is obviously in crisis. If this person's willing, patrol can take this person to the Healthy U clinic and drop them off, and they can get the help that they need. It's fantastic. It's such a good thing to have in this county. In the chance that someone needs to go to jail, Healthy U is very quick to get a therapist to the jail. After hours, on the weekends, whatever it takes, they're just as dedicated as we are in getting these people the help that they need, because we understand that jail is not the facility for people in mental health crisis. We will be the first ones to admit that. So we're really trying to make sure that we're getting them the help that they need as quickly as we can. But beyond the Sheriff's Office and the Park City Police Department and Healthy U, we also work with organizations like Connect and NAMI. Julia, I know that you spoke to my partner, Detective Buffton, and I think we're planning on meeting up with you, hopefully not too far in the future. I would love to know more about YWCA. Is there a chapter in Summit County? I don't know that there is, but could there be in the future? I think it's a lot of networking and seeing all the resources available, because what's good for one person may not be good for someone else. And so I think it takes a lot of enlightenment, but also a lot of education, like you said, Anu, a lot of education of everybody, what's available, what isn't available. Yeah, but I think we're doing the absolute best that we can, involving the criminal justice system. Even judges sometimes, if I have someone on my caseload that is struggling with a mental health issue and they come to jail for something minor, a lot of times I can approach the judge and say, I'm familiar with this person, I know what's going on here, how can we divert this, or how can we look at this a different way, so they're not just sitting in jail for a month because of something that was a fairly minor offense.
Okay, great, thank you. Aaliyah, can you talk more about justice and mental health providers, mental health courts and partnerships?
Absolutely. I've had quite a bit of experience with clients who are in either drug court for addictions or in mental health court here in Salt Lake County. And it really does make a big difference from keeping, or at least slowing down that process of being, in jail, homeless, back in jail, homeless, back in jail, homeless, because there are resources that are available to adults who are engaging in criminal activity because of their mental health status. And when we can get the judges and the police on board, and that they know these people and they know what's going on, and they have a mental health provider who are all working together, There's a lot of success that can be had. In addition to that, I loved what it said in the film, and I think that this is so important. And but to start young, if we start educating our children in the school system, in our home, what does mental health look like? What is anxiety? What is depression? Then we can avoid the whole situation altogether. And I think that's the biggest part, is engaging our community and engaging our young people and engaging our children and families, so that law enforcement can do their job, and they don't, and everybody else can do their job, and they don't have to get involved with things that are outside of their scope at times.
Thank you.
And outside of their resources.
Thank you. Anu, anything to add to this part of the discussion?
No, I love that what Aaliyah just said with starting young. You know, part of what I do as in research is community engaged research around mental health, right? And what you're saying, Aaliyah, is absolutely in line with, if anyone had any doubt, with doing dozens and dozens of focus groups and discussions with diverse communities in Salt Lake City in Utah, where we have actually a lot of diverse communities, and almost consistently, regardless of their cultural or racial background, consistently the answer that has come up is education of our youth. Because if we educate with our youth, so those parents who have talked to us who are afraid of law enforcement because of the color of their children's skin, and their kids might be struggling with mental health issues, feel even less empowered to kind of get either law enforcement involved or even medical and professionals involved because of what it might mean for their child. And so they've all called for this education at that adolescent level that has to be culturally relevant. We have a lot of folks here who don't speak English, who don't, you know, have different conceptions culturally about what mental illness means and whether it's a weakness. We've talked about stigma more broadly, but there are cultural nuances to that as well. So that education piece, and partnering also with researchers who are, you know, not just doing a study. I always say that to my community partners. I'm not interested in just doing a study and then running out the door and say, see you later, that was cool, I wrote a paper, bye. It has to be engagement with our mental health infrastructure, our law enforcement, our political bodies, so we can actually make one of those changes. So I do see that as a really, the education is a linchpin holding together a really important partnership, but the partnership has to include all the stakeholders. So just wanted to reiterate that point.
Perfect. Aaliyah, do you have something to add?
Yes, I just wanted to continue with what Anu was saying just briefly, because Utah is a refugee resettlement state. And so we do get not only immigrant families, but also refugees families, which I have worked with that are traumatized because of refugee camps or because of their the things that they experienced on the way here. And not only is education and language a barrier, but oftentimes they come from countries where they were victims of state-funded violence. And so trusting police officers and officials is really difficult for those communities as well. And I think it's really important because our communities, our international communities are growing and growing here in Utah, to be aware of the refugee and asylum seeking communities that are fleeing their countries because of state sanctioned violence in their home countries.
Thank you. Thank you for adding that. Okay, so let's take 5 minutes to answer a couple questions, and then I want to turn it over to our hosts, Liz with the YWCA, and then back to Summit Connect for some final words. So here's a great question. Someone asks, what can I do personally to advocate for the creation of long-term mental health treatment facilities in this nation? So I'm going to change that around. How can an individual advocate for better mental health care in this state? Anyone?
I think Steve, you might be the best
Yeah,
answer to that
people
question.
can jump in. I see. Okay, we have you on, Detective. Go ahead.
I think one of the best ways to advocate is really to talk to your local lawmakers, your legislators, your senators, your Congress. A lot of people think that's such a difficult process, but it really actually isn't. They want to hear from their citizens, from their constituents. And if more and more people reach out to them. You can send them an email. You know, it doesn't have to even be this whole big, I need to schedule a meeting and I have to wear a suit. It's not like that. Get the conversation going, and those are the people that have the power to make the change.
Perfect. Julia, can you add anything to that? How can individuals better advocate for mental health in Utah?
I really wanted to advocate for contacting the National Alliance on Mental Illness. And I think what so many people don't realize is your lived experience is a great gift to share with other people. A lot of us are like, oh, what do I know? I don't have a degree in psychology. What you've been through is so valuable, and what you bring to the table is so valuable. And the National Alliance on Mental Illness really needs your presence in those support group rooms, in those education rooms, or even just, you know, if that's not your thing, stuffing envelopes, whatever it is. NAMI really, really needs to hear from you. You are such a valued part of the solution to all this, which is just raising awareness, getting rid of discrimination. Please, please, please contact NAMI. Is so anxious to hear from you.
Okay, the next question is, why don't elected leaders do better with mental illness? Is it because they don't understand the problem, or they see it and think it's too big? So someone who spent 16 years in the legislature, I'll answer yes is the answer. We don't understand it. Then when we understand it, we see it's awfully big. And so I would suggest reach out and make it easier for elected officials. Walk them through, let me make sure you understand what this is. Here's some steps we can take. Does anyone else want to add anything to that? Okay, how are we doing in Utah overall with mental health? Anyone on that?
I think Aaliyah.
Are you all being polite? And the answer is, go ahead, please.
Aaliyah, did you have a thought?
Well, on a broad scope, I couldn't speak to on a broad scope how Utah is doing with mental health. However, there's not enough resources in Utah for the mental health issues that we have. As a clinician, I'm often looking at a family or an individual that could really use services that are just not available. And, you know, we try to cobble together something out of often thin air, if not thin air, nothing to support and to wrap around and to engage families and individuals and communities that are struggling with mental health. And there's just not enough funding. There's not enough programs. There's not enough knowledge. There's not enough resources. And I think and part of that is, I've lived here in Utah for 20 years, and it has grown so big and so fast that sometimes it's hard to keep up with that. But I think overall, like we have to do better with having resources for families. Like, that's great to have them come out of silence, but what do we do with them once they do?
Okay, so last question for this group. If anyone wants to field it, someone talked about the old system, you know, a BEDLAM type of system versus what we're talking about, the MCOT that's happening in some. What are the relative costs and what are the relative benefits of doing it with trained teams and support?
I certainly couldn't speak to numbers. I have been told many, many times that if we did, as Anu mentioned, if we intervened at early ages and had the kind of support that Aaliyah was saying, you know, is so lacking. And honestly, when you ask that question, what's the state of mental health care in Utah? I couldn't even think how to answer. It was so overwhelming to kind of address what Aaliyah said, the shortfalls. But if we address mental health more compassionately earlier, I've been told many times by many different types of professionals that it would be far less expensive than the way we address it now, which is sort of this cycling, jail, homeless, hospitalization. It's
Reactive, right?
very
Instead of proactive.
reactive. Yeah,
Right.
it's very expensive. If all you cared about, if you didn't care about the people at all, and all you cared about were the dollars, the way we do it is very cost inefficient. And the reality is that the way we should do it would also save us money and save so many lives and so many families.
Perfect. What a great ending. Panelists, thank you very much. Wonderful job. Liz, let me turn it back to you as one of our co-hosts for this, and then after you, Connect Summit can bring us home.
Thank you. Well, we just want to thank the panel for your expertise and your experience. Of course, thank you to Connect Summit County for all of your work and for the dedication in organizing this event and other events. The YWCA Utah has been really honored to collaborate with Connect Summit County in hosting this conversation and furthering this important work. And I would add that our partnership, I feel, really highlights the way in which community organizations serving our communities most vulnerable overlap and intersect. And I do believe we are stronger together. And I think what has been evident in this panel of diverse experts and stakeholders is the many ways we are moving forward. I think that there is hope in that our society can keep getting better in the ways that we treat each other. And as long as we continue to reach out together and attend to the most vulnerable in our communities with compassion and with education and with collaboration. So thank you.
That was great. Thank you so much, Liz. And before I thank the panel, I want to give a huge shout out to Thea Holcomb, who helped us actually staff this panel. And I really, she actually is a college student and has her, she understands the issue and was really pivotal in pulling this together. And I appreciate everybody that sits on this panel, but because for Connect Summit County, this is a very different type of panel than we normally do. I think a lot of times we talk to the same people and we use the same people in our conversations. And so this was a really unique and broad perspective. So I'm just so appreciative of every single one of you and everybody that tuned in today. We did record it, so hopefully you've either tuned in or you're able to catch this recording, but just appreciate you taking an hour of your time to join us, because I think it's just barely a little sliver of the conversation we need to be having. We think we uncovered some really great things today. So I am going to throw it over to Betty Morin, who is our event logistics coordinator, to talk about some upcoming events and some follow-up from this, and we'll just be a few more seconds. So thank you so much, everyone.
Thank you, Deanna. Hi there, I am Betty Morin, and we have some amazing events coming up to support this conversation. And the one that I would really like to highlight is an event called Crisis Response in Your Community. And we are welcoming Sherry Whitwer of Crisis Intervention Teams Utah, and Todd Soder of Davis County Behavioral Health. And they are going to share with us what works in connecting with a mobile crisis response team or a CIT or any of these amazing teams that we're starting to bring together in our communities to respond and not make law enforcement do something that isn't really in the wheelhouse or they don't have resources for, right? So we invite you to that event that is on September 8th at 3 p.m. And that's the main one that really focuses on extending this conversation. So with that, thank you all so very much. Please stay engaged in the conversation, stay engaged in your communities, because we need everyone to be part of this conversation in order to move the needle forward and actually shift what we're doing in this space of mental health. So thank you all so very much.